Very good morning to all of you. Today we will be dealing with a very important MCQs of obstetrics and gynecology. So let us begin with the first MCQ. Zygote with zona pellucida reaches uterine cavity by A 2 days, B 4 days, C 5 days, and D 6 days. So zygote with zona pellucida reaches the uterine cavity by how many days? What do you think is the correct answer? Zygote with zona pellucida reaches the uterine cavity by A 2 days, B 4 days, C 5 days, and D 6 days. It is 4 days. Zygote with zona pellucida reaches the uterine cavity by 4 days. The role of human placental lactogen is A. Stimulate milk production, B. Fetal breast development, C. Growth of fetus, D. Endocrine regulation. Now let us see what is human placental lactogen. Human placental lactogen is a hormone which provides the fetal nutrition. It provides the fetal nutrition by antagonizing the action of, this means that it opposes the action of insulin in the maternal circulation. Insulin in the maternal circulation. Number two, this HPL is angiogenic, means angio means blood vessels. So there is an increase in fetal vasculature due to human placental lactogen. Then there is growth of breast for lactation. So there is a growth in the maternal breast for lactation. So the correct answer here is growth of fetus. Most common site of implantation of tubal pregnancy is A. Interstitial portion of fallopian tube, B. Isthmus, C. Ampulla, D. Infundibulum. Most common site of implantation of tubal pregnancy is A. Interstitial portion of fallopian tubes, B. Isthmus, C. Ampulla, and D. Infundibulum. So this ampulla is a broad portion. So the most common site of implantation of tubal pregnancy is ampulla. Another thing to note is that if there is a ampullary tubal pregnancy, there is a minimum risk of rupture. But if there is a isthmic ectopic pregnancy, there is a maximum risk of rupture of ectopic pregnancy. This ectopic pregnancy is a very important topic. We should master this topic before we appear for the exam. So the correct answer here is ampulla. During which gestational age is peak serum HCG level attained? A. 7 to 9 weeks, B. 11 to 13 weeks, C. 20 weeks, and D. 25 weeks. Peak serum HCG levels is attained at what time? Now, this human chorionic gonadotropin hormone, the levels double every 30.9 hours. So there is a double of HCG titer in 30.9 hours. So the doubling time is 30.9 hours. It reaches a maximum of 6,500 international unit per liter by 8 weeks. 8 weeks. Then it peaks. It depends upon the circumstances. Again, it decreases between 12 to 16 weeks. So, the correct option here appears to be 8 weeks, that is between 7 to 9 weeks, that is A. So, peak serum HCG levels are attained at 8 weeks, that is between 7 to 9 weeks. What would be type of presentation when the engaging diameter is mento-vertical? When the engaging diameter is mento-vertical, it is about 14 centimeter diameter. The presentation is usually bro presentation. This bro presentation is a very rare presentation. So the correct option here is B, bro presentation. What would be the type of presentation when the engaging diameter is mento-vertical? A, face. B, bro. C, vertex. D, breech. It is B, bro presentation. Most common cause of secondary PPH. PPH means postpartum hemorrhage. A, uterine inertia. B, retained placenta. C, episiotomy. D, cervical tear. So most common cause of secondary PPH is A, uterine inertia. B, retained placenta. C, episiotomy. D, cervical tear. Now, this late PPH, postpartum hemorrhage, occurs post 8th to 14th day of delivery. So it occurs on either day 8 to 14th postpartum, that is after delivery. So the most common cause of secondary PPH is retained placenta. Retained placenta. Other causes of postpartum hemorrhage are infection and separation of slough over deep cervicovaginal laceration. Infection and separation of slough over deep cervicovaginal laceration. Other causes are endometritis. Endometritis, subinvolution of placenta. Subinvolution of placenta. So most common cause of secondary PPH is B, retained placenta. Most common cause of secondary PPS is retained placenta. Incidence of scar rupture in a subsequent pregnancy in case of LSCS, that is lower segment cesarean section, is A, 2%, B, 4%, C, 5%, D, 8%. A, 2%, B, 4%, C, 5%, D, 8%. So the incidence of scar rupture in subsequent pregnancy is very low. It is about 0.5 to 1.5%. Since the option is not given, so the nearest correct option is 2%. So the correct answer here is A, 2%. Subpubic angle is A, less than 65 degree, B, 65 to 75 degree, C, 85 degree, and D, 110 to 120 degree. What do you think is the correct answer? Please write in the chat box. Subpubic angle is A, less than 65 degree, B, 65 to 75 degree, C 85 degree, D 110 to 120 degree. Let us check what is the correct answer. Subpubic angle is 85 degree. Rule of Hasse is used to determine A. The age of fetus, B. The height of an adult, C. The race of a person, D. Identification. Rule of Hasse is used to determine A. The age of fetus, B. The height of an individual, C. The race of person, and D. Identification. We all know that rule of Hasse is used to determine the age of fetus. So the correct option here is rule of Hasse is used to determine the age of fetus. Indication of acyclovir in pregnancy. A. Disseminated herpes. B. Chickenpox in the first trimester. C. Prophylaxis in recurrent herpes. Here, the acyclovir is used in pregnancy in disseminated herpes also. It is used in chickenpox in the first trimester also. Prophylaxis in recurrent herpes also. So the correct answer is D, all the above. So indication of acyclovir in pregnancy is A, disseminated herpes, chickenpox in first trimester, prophylaxis in recurrent herpes. That is all of the above. D. Human placenta. Now, let us see what human placenta is. Human placenta is disc shaped, so it is discoid. Hemochorial, it is in contact with blood, so hemochorial. Deciduate, it separates, so deciduate also. So human placenta is discoid, it is hemochorial, it is deciduate. The last option is D, all the above. So human placenta is discoid, hemochorial, and deciduate. So the correct option here is D, all the above. Human placenta is discoid, hemochorial, deciduate, all of the above. Hot flushes. Now, these hot flushes, why they are experienced? Hot flushes are experienced as a result of A. Increased noradrenaline. Yes, hot flushes are due to increased noradrenaline, and this increased noradrenaline, it disturbs the thermoregulation of the body. Decreased estrogen, of course, it is due to decreased estrogen. C. Increased noradrenaline and decreased estrogen. Yes, there is increased noradrenaline and decreased estrogen. Increased noradrenaline estrogen. No, it is not increased in noradrenaline estrogen. Increased noradrenaline is correct and decreased estrogen is correct. So the correct option here is increased noradrenaline and decreased estrogen. Cephalic index is A. BPD by OFD, biparietal diameter by occipitofrontal diameter. B. Biparietal diameter by head circumference. C. OFD by biparietal diameter, D HC by FL, head circumference by fetal length. So cephalic index, the definition is it is biparietal diameter divided by occipitofrontal diameter. So the correct option here is biparietal diameter by occipitofrontal diameter. In MRKH syndrome, what is MRKH syndrome? MRKH syndrome is Mayer-Rokitansky-Kuster-Hauser syndrome. Mayer-Rokitansky-Kuster-Hauser syndrome. What happens in MRKH syndrome? In MRKH syndrome, there is Mueller agenesis, renal aplasia, cervicothoracic somatic dysplasia, cervicosomatic, cervicothoracic somatic dysplasia, and 46XX karyotype. 46XX karyotype. So MRKH, that is Mayer-Rokitansky-Kuster-Hauser syndrome. Mayer-Rokitansky-Kuster-Hauser syndrome. In Mayer-Rokitansky-Kuster-Hauser syndrome, ovaries are present. Ovaries are present. Secondary sex characters are normal. Secondary sex characters are normal. In Mayer-Rokitansky-Kuster-Hauser syndrome, there is congenital aplasia of the uterus. Congenital aplasia of the uterus and upper part, congenital aplasia of upper part, that is two-thirds of vagina. Congenital aplasia of upper part, that is upper two-thirds of vagina. The secondary sex characters are normal. And what about the karyotype in MRKS syndrome? The karyotype in MRKS syndrome is 46XX. Karyotype in MRKS syndrome is 46XX. 46XX. So in testicular insensitization, it is testes are present, testicular insensitization. Whereas in MRKH, ovaries are present, testis is absent. So the in MRKH syndrome, which of the following is absent? A. Vagina. B. Breast development. As I have told you, secondary sex characters are normal. Pubic hair development. Yes, these are all normal. Testis is absent. In MRKH syndrome, testis is absent. Ovaries are present. So the correct option here is D. Testis. Polyspermy. Polyspermy is inhibited by which ion? A. Ca. B. Na. C. K. D. Cl. So polyspermy is inhibited by calcium, sodium, potassium, chloride. Any guesses, please? Write in the chat box if you have any guesses. Polyspermy is inhibited by which ion? Polyspermy is inhibited by calcium ion. So polyspermy is inhibited by calcium ion. The correct option is A. Maximum amniotic fluid is at. When is the amniotic fluid maximum? A. 32 weeks. B. 34 weeks. A. 32 weeks. B. 34 weeks. C. 36 weeks. And D. 40 weeks. Maximum amniotic fluid is present at A. 32 weeks. B. 34 weeks. C. 36 weeks. And D. 40 weeks. Maximum amniotic fluid is present at 36 weeks. Maximum amniotic fluid is present at 36 weeks. Maximum amniotic fluid is present at C. 36 weeks. Fertilization usually occurs in which part of fallopian tube? Fertilization usually occurs in which part of fallopian tube? It is a simple question. It is ampulla. Fertilization usually occurs in which part of fallopian tube? Ampulla. Physiological change in leukocyte number. What happens to leukocyte number in pregnancy? A. Neutrophilic leukocytosis. B. Lymphocytic leukocytosis. C. Neutropenia. D. Basophilic leukocytosis. Neutrophilic leukocytosis. B. Lymphocytic leukocytosis. C. Neutropenia. D. Basophilic leukocytosis. Physiologic change in leukocyte numbers in pregnancy. A. Neutrophilic leukocytosis. B. Lymphocytic leukocytosis. C. Neutropenia. D. Basophilic leukocytosis. Correct option here is A. Neutrophilic leukocytosis. Weight of uterus at term is A. 400 to 500 gram. B. 600 to 700 gram. C. 800 to 900 gram. And D. 900 to 1000 gram. Weight of uterus at term is D. 900 to 1000 gram. Weight of uterus at term is D. 900 to 1000 gram. Urinary retention earliest in pregnancy is seen at A. 10 weeks. B. 18 weeks. C. 22 weeks. And D. 34 weeks. Urinary retention earliest in pregnancy is seen at A. 10 weeks. Down syndrome is earliest diagnosed at A. 8 to 10 weeks. B. 10 to 12 weeks. C. 12 to 14 weeks. D. 14 to 16 weeks. Down syndrome is earliest diagnosed at B. 10 to 12 weeks. Down syndrome is earliest diagnosed at B. 10 to 12 weeks. When is folic acid started in pregnancy? A. 4 weeks prior to conception. B. 8 weeks prior to conception. C. 4 weeks after conception. D. 8 weeks after conception. When is folic acid started in pregnancy? A. 4 weeks prior to conception. B. 8 weeks prior to conception. C. 4 weeks after conception. D. 8 weeks after conception. So the correct option here is 4 weeks prior to conception. Turn placenta weight to baby ratio is, we all know that turn placenta weight to baby ratio is 1 is to 6. A 1 is to 3, B 1 is to 4, C 1 is to 5, D 1 is to 6. So the correct option here is 1 is to 6. Persistent occipito-posterior position is most common in which pelvis? A. Android, B. Gynecoid, C. Anthropoid, D. Mixed. It is persistent occipito-posterior position is most common in android pelvis. Pregnant uterus will compress ureters at A. Pelvic bring, B. Uterovesical junction, C. Trigone, and C. uretrovesical junction. So pelvic brim, A. B. Utero, that is uterus and vesical junction. C. Trigone, and D. Uretrovesical junction. The correct option here is A. Pelvic brim. So let us revise the MCQs one by one. Let us revise the MCQs one by one. Zygote with zona pellucida reaches uterine cavity by A. 2 days, B. 4 days, C. 5 days, and D. 6 days. Correct option here is B. 4 days. So zygote and zona pellucida reach the uterine cavity by 4 days. The role of human placental lactogen is A. Stimulate milk production, B. Fetal breast development, C. Growth of fetus, and D. Endocrine regulation. It is growth of fetus. Most common site of implantation of tubal pregnancy is A. Interstitial portion of fallopian tube, B. Isthmus, C. Ampulla, D. Infundibulum. Correct option here is C. Ampulla. During which gestational age is peak serum HCG levels attained? A. 7 to 9 weeks, B. 11 to 13 weeks, C. 20 weeks, and D. 25 weeks. Human chorionic gonadotropin level peak serum levels are attained at about 8 weeks, 6,500 international unit per liter. So it is seen at 7 to 9 weeks. The correct option here is A. 7 to 9 weeks. What would be the type of presentation when the engaging diameter is mento-vertical? It is bro presentation, B. Most common cause of secondary PPH is A. Uterine inertia, B. Retained placenta, C. Episiotomy, D. Cervical tear. It is retained placenta, B. The incidence of scar rupture in subsequent pregnancy in case of LSCS is A. 2%, B. 4%, C. 5%, D. 8%. So the correct option here is A. 2%. Subpubic angle is A. Less than 65 degree, B. 65 to 75 degree, C. 85 degree, and D. 110 to 120 degree. So the correct option here is C. 85 degree. Rule of Hasse is used to determine A. The age of fetus, B. The height of individual, C. Race of a person, and D. Identification. We all know the rule of Hasse is used for the estimation of age of fetus. Indication of a cyclover in pregnancy is A. Disseminated herpes, B. Chickenpox in the first trimester, C. Prophylaxis in recurrent herpes, and D. All of the above. So acyclovir is used in disseminated herpes also when the herpes is completely disseminated. Acyclovir is used in chickenpox also when it is in the first trimester, and acyclovir is used in prophylaxis in recurrent herpes also. So the correct option is D, all the above. Human placenta is discoid, disc-shaped, hemochorial, in contact with the blood, hemochorial, deciduate. So the correct option here is D, all of the above. Hot flushes are experienced as a result of A. Increased noradrenaline, B. Decreased estrogen, C. Increased noradrenaline and decreased estrogen, and D. Increased noradrenaline and estrogen. So hot flushes are due to increased noradrenaline. It is correct. Increased noradrenaline, what happens? It breaks down the thermoregulation of the body. As a result, there is hot flushes. Decreased estrogen is also there. So there is increased noradrenaline and decreased estrogen. So the correct option here is C. Cephalic index. The definition of cephalic index is biparietal diameter upon occipitofrontal diameter. Let us look at the options. A. BPD by OFD. B. BPD by head circumference. C. OFD by BPD. D. Head circumference by fetal length. The correct option here is A. BPD by OFD. In MRKH, that is Mayer-Rokitansky-Kuster-Hasse syndrome, what happens in Mayer-Rokitansky-Kuster-Hasse syndrome? There is Mueller-Regenesis, renal aplasia, cervicothoracic somoid dysplasia. The karyotype is normal, 46XX karyotype. Secondary sex characters are normal. Ovaries are present. Ovaries are present. But in testicular insensitization, androgen insensitivity syndrome, it is testes are present. So what happens in MRKH syndrome? There is congenital aplasia of the uterus and upper part, that is upper two-thirds of vagina, 46XX karyotype, and normal secondary sex characters, and ovary is present, testis is absent. So the options are A. Vagina, B. Breast development, pubic hair development. Pubic hair development is there, breast development is there, vagina is there. Testis is absent. So the correct option here is D. Testis. Polyspermy is inhibited by which ion? A. Calcium, B. Sodium, C. Potassium, D. Chloride. The correct option here is A. Calcium. Maximum amniotic fluid is present at 36 weeks of pregnancy. Fertilization usually occurs in which part of fallopian tube? Fertilization usually occurs in ampulla of fallopian tube. A. Fimbrial and B. Ampulla, C. Interstitium, D. Isthmus. So the correct option here is B. Ampulla. Physiologic change in leukocyte numbers in pregnancy is A. Neutrophilic leukocytosis, B. Lymphocytic leukocytosis, C. Neutropenia, D. Basophilic leukocytosis. So the correct option here is A. Neutrophilic leukocytosis. Weight of uterus at term is 900 to 1000 gram. Options are A. 400 to 500, B. 600 to 700, C. 800 to 900, D. 900 to 1000 gram. So the correct option here is D. 900 to 1000 gram. Urinary retention earliest in pregnancy is seen at A. 10 weeks, B. 18 weeks, C. 22 weeks, D. 34 weeks. This correct option is A. 10 weeks. 21. Down syndrome is earliest diagnosed at A. 8 to 10 weeks, B. 10 to 12 weeks, C. 12 to 14 weeks, D. 14 to 16 weeks. So correct option here is B. 10 to 12 weeks. So Down syndrome is earliest diagnosed at 10 to 12 weeks. Down syndrome is a very important topic as per the National Exit Test and the Neet PG exam and INICET exam. Every point related to Down syndrome must be done thoroughly. B. 10 to 12 weeks. When is folic acid started in pregnancy? A. 4 weeks prior to conception, B. 8 weeks prior to conception, C. 4 weeks after conception, D. 8 weeks after conception. So the correct option here is A. 4 weeks prior to conception. Term placenta weight to baby ratio is A. 1:3, B. 1:4, C. 1:6, D. 1:6. So term placenta weight to baby weight ratio is D. 1:6. Persistent occipito-posterior position is most common in which pelvis? A. Android, B. Gynecoid, C. Anthropoid. D. Mixed. A. Android. Pregnant uterus will compress ureters. A. At pelvic brim. B. Utrovesical junction. C. Trigone. D. Uretrovesical junction. Pregnant uterus will compress ureters at A. Pelvic brim. We will meet again at 9:30 p.m. today with a new topic and new subject. So please be live at 9:30 p.m. today. Thanks a lot.